Hey, my name's Anand Fatima, and I'll be evaluating ginkgo biloba and blackcurrant anthocyanin therapies in glaucoma. So, eye diseases can be defined as a broad spectrum of eye conditions which can lead to vision impairment, many resulting in blindness and permanent vision loss. And vision impairment can be defined as limitation of actions and functions of the visual system which inhibit an individual's ability to function in a manner to other human beings. Low vision is visual impairment not correctable by glasses, contact lenses, medication, or surgery that interfere with the ability to perform activities of daily living. Some common eye conditions include age-related macular degeneration, cataracts, glaucoma, and diabetic retinopathy. Globally, an estimate of 2.2 billion people have vision impairment or blindness. 1 billion have a vision impairment that could have been prevented or has yet to be addressed. 12 million people 40 years old or over in the US have vision impairment, and as of 2012, 4.2 million Americans aged 40 years and older suffer from uncorrectable vision impairment, out of which 1.2 are blind, and this number is predicted to more than double by 2050, up to 8.96 million people. The annual economic impact of major vision problems among the adult population 40 years old and older is more than $145 billion. And common risk factors for eye disease include smoking, alcohol, poor nutrition, and aging. Glaucoma is a disease that damages the eye's optic nerve. It occurs when fluid or aqueous humor builds in the front of the eye. The extra fluid increases the pressure in the eye, damaging the optic nerves. The two major types of glaucoma are primary open angle, which is the most common type and happens gradually where the eye does not drain fluid as well as it should, resulting in eye pressure buildup and damaging the optic nerve. And this is a type of glaucoma that's painless and causes no vision changes at first. Angle closure glaucoma happens when someone's iris is very close to the drainage angle in their eye. It ends up blocking the draining angle, and many people with it end up developing it slowly, but it can cause blindness if it's not treated right away. For diagnosis, a complete eye exam is done, and for the signs and symptoms of open angle, there are no warning signs or obvious symptoms in the early stages, but as the disease progresses, blind spots develop in your side vision. For angle closure, some early symptoms of an attack may include blurred vision, halos, mild headaches, or eye pain. And for treatment, glaucoma damage is permanent and cannot be reversed, but medication and surgery can help to stop further damage, and laser surgery is used to treat glaucoma. It is estimated that over 3 million Americans have glaucoma, but only half of those know they have it. As shown on the right are the projections for glaucoma in 2030 and 2050. Glaucoma is also the second leading cause of blindness in the world. Estimates put the total number of suspected cases of glaucoma at over 60 million worldwide. The cost of glaucoma accounts for more than 10 million visits to physicians each year, and the average direct cost of glaucoma treatment ranges from $623 per year for patients with early-stage glaucoma to $2,511 per year for patients with end-stage disease. The pathophysiology of glaucoma is believed to be multifactorial. Multiple factors acting either on cell bodies or their axons are believed to lead to retinal ganglion cell death. The main problem or pathology in glaucoma is caused by raised intraocular pressure, or IOP, and it is this raised pressure that compresses and damages the optic nerve. Now, once the optic nerve is damaged, it fails to carry visual information to the brain, and this results in a loss of vision. The exact pathophysiology contributing to this is not fully understood, but it's believed that the raised pressure in the retina causes the cells and the nerve ganglions in the sensitive retina to die off, which is retinal ganglion apoptosis. And in addition to the small blood vessels of the retina are also compressed, depriving it of nutrients, and this all results in a clinically progressive loss of peripheral visual field, and ultimately vision. Ginkgo biloba is one of the most ancient living trees that has existed for more than 250 million years. The therapeutic benefits of the ginkgo leaf extracts have been well known, proven by the fact that they have been used in traditional Chinese medicine for more than 5,000 years. The seeds are traditionally used in China as a tonic, however, only the leaves of the trees are used to prepare the commercial extracts now available on the US market as botanical dietary supplements. Ginkgo research began due to its interest of its antioxidant and neuroprotective properties that it's generated, which can be used against glaucoma, and beneficial effects can be explained by antioxidant and vascular protector properties, which result in improved ocular blood flow. The antioxidant capacity of the extract can be explained by its ability to act as a free radical scavenger of nearly all reactive oxygen species, or ROS types, and it can inhibit lipid peroxidation. Furthermore, antioxidant properties of ginkgo are particularly interesting given the ability of its active principles, mainly the flavonoid fraction, to act at the mitochondrial level, unlike other antioxidants. Ginkgo biloba extracts, or GBEs, can also be used as neuroprotectors, which can prevent retinal ganglion cell damage. The first study on ginkgo biloba aimed to evaluate the short-term effects of ginkgo biloba extract, or GBE, on peripapillary retinal blood flow in patients with normal tension glaucoma, or NTG. We discussed how elevated IOP relates to the pathogenesis of this disease. Now let's discuss another theory called the vascular theory briefly. The vascular theory related to the pathogenesis of glaucoma is that tissue ischemia from impaired blood flow causes glaucomatous damage. NTG is a form of open-angle glaucoma in which optic nerve damage and glaucomatous visual field loss occurs without the IOP exceeding the normal range. Now, treatment of glaucoma is almost always focused on lowering the IOP, but some patients with NTG continue to suffer a visual field defect despite sufficient control of IOP. Therefore, pharmacologic treatment of the vascular mechanism underlying glaucoma should be emphasized in NTG patients. Now, this study was a randomized, double-masked, placebo-controlled clinical trial. There were 30 participants with normal tension glaucoma between the ages of 18 and 80. 15 were in the GBE group, which were given 80 milligrams of GBE orally to consume twice a day for 4 weeks. There were 15 participants in the control group, which were given a placebo orally twice a day for 4 weeks. Both groups were given complete ocular examinations on the first day of the study and the completion of treatment. The results showed an increase in blood flow in response to the GBE group compared to the placebo group at all points except the superior nasal peripapillary area and optic cup areas. Blood volume significantly increased after intake of GBE compared to the placebo group in inferior temporal neuroretinal rim and superior temporal peripapillary area. Some limitations included short-term follow-up period. So the study cannot comment on the long-term effects of GBE administration. And further study is required to investigate the duration of the effect and optimal administration schedule for GBE treatment for NTG patients. The next study aims to evaluate the effect of GBE and anthocyanins on visual function in patients with NTG, again based on the vascular theory of mechanism of glaucomatous optic nerve damage. This study was a retrospective study conducted on 332 participants, 209 being men and 123 being women. The mean age of the participants was 52 years, and all participants had monocular or binocular NTG. 103 participants were in the GBE treatment group, 132 were in the anthocyanin treatment group, and 97 were in the control group. The GBE treatment group were given a tablet with 80 milligrams, anthocyanin treatment group were given a tablet with 60 milligrams, and the control group was given a placebo tablet. Participants were instructed to take 2 capsules daily, one after breakfast and one after supper. The follow-up duration for each treatment group ranged from 12 months to 59 months. The results suggested that systemic administration of GBE and anthocyanins improves visual function in some individuals with NTG. Limitations of the study included being of retrospective nature, so they cannot exclude the possible effects of selection bias. However, the study did do their best to recruit consecutive patients in order to minimize this. They didn't investigate the duration of the effect and optimal administration schedule for GBE and anthocyanin treatment for NTG patients, so further studies would be needed on this. The next study we'll look at aimed to evaluate the effect of GBE on visual field defect and contrast sensitivity in a cohort with NTG. This study was a prospective randomized placebo-controlled crossover study conducted on 35 participants with the average age of 63 and newly diagnosed with NTG. 17 participants were randomized to receive GBE first, then the placebo, and 18 were randomized to receive the placebo first, then GBE. Group 1 started with 4 weeks of GBE treatment and then 8-week washout period of using nothing, then 4 weeks of using the placebo. Group 2 started with 4 weeks of the placebo, an 8-week washout period, and 4 weeks of the GBE treatment. The GBE treatment included 40 milligram capsules, and the placebo were 40 milligrams of fructose and starch. Participants took the capsules 3 times a day, and the results showed that GBE had no effect on mean defect or contrast sensitivity in the group of NTG participants. Possible explanations behind why the negative findings occurred were that GBE may not affect visual function in patients with glaucoma. The effect size maybe have been too small to be detected by their small trial, and the treatment period of 4 weeks may not have been sufficient time to reveal a clinical benefit. Now let's go over the overall evaluation of ginkgo biloba. In study 1, it found GBE can produce desirable effects on ocular blood flow, volume, and velocity with NTG patients. In study 2, it was found that GBE use can be effective in improving visual functions in patients with NTG. In study 3, they found no effect on mean effect or contrast sensitivity in NTG patients. One difference to note is that study 1 and 2 treatment groups received 160 milligrams of GBE, whereas in study 3 the treatment group received 120 milligrams of GBE, and this difference could have affected the results a bit. In regards to safety, there is no ocular or systemic side effects reported by patients after treatments in all 3 studies, and overall GBE may be beneficial as a systemic treatment for NTG patients, but further studies will be needed to investigate the duration of the effect and the optimal administration schedule for GBE. The next natural product we'll be talking about is blackcurrant anthocyanins. Blackcurrant has been used for medicinal purposes for over 600 years. People have used the blackcurrant plant whole, as a seed oil, infusions and teas out of the plant's leaves, and as supplements. Anthocyanins are polyphenols found in food and beverages like red wine and berries. It's widely recognized for their antioxidative stress and anti-inflammatory effects. Anthocyanins in blackcurrants have been implicated in the improvement of visual functions such as dark adaptation and transient refractive alternation. The first study examined the influence of blackcurrant anthocyanins, or BCACs, on the disease progression of open-angle glaucoma, or OAG. This was a randomized double-masked placebo-controlled trial with 38 participants who had OAG, and it was being treated by anti-glaucoma drops. There were 19 participants in the BCAC group, which were given 50 milligrams of the oral supplement per day. There were 19 participants in the placebo group, which were given 50 milligrams of the oral placebo per day, and they were instructed to take it once a day for 24 months. The results revealed that oral administration of BCACs slowed down the visual field deterioration and elevation of ocular blood flow of open-angle glaucoma, and there is no significant changes observed in the systemic and ocular condition, including IOP, during the 24-month period. The next study aimed to understand the underlying mechanisms of BCAC-induced effects and antioxidant activities. This was a randomized double-masked placebo-controlled single-center trial with 38 participants with OAG. There was 19 participants in the BCAC group who consumed 50 milligrams a day for 24 months, and the placebo group had 19 participants who also consumed 50 milligrams of the placebo once a day for 24 months. There was also 20 healthy volunteers with matching age and gender used as the control group, and serum specimens were obtained at baseline and every 6 months from the participants. Results in this study were significant because they had a continuous supplementation of BCACS, and this caused normalization of decreased levels of serum endothelin 1 concentrations in patients with OAG. So ET1 is a potent vasoconstrictor, which is believed to play a role in local autoregulation of blood flow. So within ocular or eye tissues, ET1 receptors are expressed in the retina and the optic nerve head. And a number of studies have conflicting conclusions indicating there's no consensus regarding serum levels of ET1 in patients with glaucoma, but ET1 receptors may be upregulated in response to continued lowered levels of serum ET1 levels, since ET1 has a positive feedback of its receptors. So if this speculation was correct, BCACs induced normalization of ET1 and its receptor balance may be beneficial for ocular blood circulation, since an increased ET1 reactivity could lead to a decreased ocular blood flow and slow down a patient's glaucoma progression. The next study observed the effects of oral administration of BCACs on IOP in healthy participants and participants with glaucoma. The first arm was a double-blind, placebo-controlled crossover study with 12 healthy subjects who used 50 milligrams of BCAC a day for 4 weeks, followed by a 2-week washout period, then 50 milligrams of placebo for 4 weeks, then switched off. The second arm was a randomized, double-blind, placebo-controlled trial conducted on 21 glaucoma patients who participated in previous study treated with a single anti-glaucoma medication. 12 participants were in the BCAC group and took 50 milligrams a day of BCAC for 24 months, and 9 participants were in the placebo group for 24 months. The results suggested that oral administration of BCACs may induce a beneficial decrease in IOP levels in healthy subjects as well as patients with glaucoma. Going over the overall evaluation of blackcurrant anthocyanins, oral administration of BCACs may be a safe and promising supplement for patients with OAG, in addition to anti-glaucoma medication use. It also may be great for suppression of the visual field deterioration in subjects with OAG, and BCACs may induce a beneficial decrease in IOP levels in healthy subjects as well as patients with glaucoma. Overall, there is no systemic and ocular side effects detected in any of the studies also. Let's go over some take-home recommendations. For individuals with normal tension glaucoma, GVE may improve visual field and increase ocular flow when taking between 120 and 160 milligrams per day in capsule form. Some side effects include headache, upset stomach, dizziness, palpitations, constipation, and allergic skin reactions, and it may interact with medications such as blood thinners. For blackcurrant anthocyanins, for individuals with OAG who are taking one medication to treat glaucoma, BCACs may slow the visual field deterioration and increase ocular blood flow, and it may be beneficial for healthy individuals without glaucoma to reduce their risk of developing it. The recommendation is 50 milligrams daily in capsule form, and side effects include soft stools, mild diarrhea, intestinal gas, and it's not recommended for individuals with bleeding disorders or those about to have surgery as a canceled blood vein. If you're thinking about adding any dietary supplement, make sure to talk to your doctor before doing so. Other therapies for glaucoma management include acupuncture. There's a limited number of studies that report benefits, including reduced IOP, improving visual acuity, and opening the visual field in glaucoma patients. Cannabidiol is a non-psychoactive part of cannabis, and there's preliminary animal research suggesting it may help with glaucoma patients as it is a neuroprotectant and improves blood flow to the optic nerve, but more human trials are needed. PEA supplement is an alternative to marijuana as it's a natural chemical that occurs in our brains and works via a similar pathway. It provides the eye pressure lowering and pain reducing benefits without the high, and a placebo-controlled human trial suggests that 300 milligrams of PEA supplement twice a day may lower IOP in normal and high pressure glaucoma and may improve visual field. Here are some of my references, and here are the rest. Thank you for listening.